Traditional mental health support typically operates on a reactive model. You seek help when you're already struggling. By the time a leader is showing visible signs of stress or burnout, it's already affecting their decision-making and leadership capability. 55% of CEOs are struggling with their mental health right now, but less than 2% will ever admit it. The higher you climb in leadership, the lonelier and more dangerous it gets. I've spent the last decade working with senior executives and federal leaders like yourselves, and I've discovered something troubling. The mental health crisis at the top is far worse than anyone realizes. Traditional support systems are failing our leaders, and it's not just hurting them, it's destroying the entire organization from inside out. In this video, I'm going to reveal why conventional mental health support systems fall short for senior decision makers. I will share the exact framework we use to help executives maintain peak performance without burning out, and show you how one CEO reduced burnout symptoms by 40% in just 90 days using a simple 10-minute practice. But first, let me share a story that changed how I view executive mental health forever. 3 years ago, I was sitting across from the CEO of a Fortune 500 company. Now, on paper, he had everything: running a billion-dollar organization, respected in his industry, seemingly at the top of his game. But behind closed doors, he hadn't slept more than 3 hours a night in months. The weight of constant decision-making was crushing him, but he felt he couldn't show any weakness. He said, "If my board finds out I'm struggling, I'll lose everything I've worked for." This is the reality of leadership that nobody talks about. And as someone who's worked with hundreds of executives and experienced these pressures firsthand as a CEO, I understand exactly why traditional mental health support systems are failing leaders, and more importantly, what actually works. Let me break down 3 critical reasons why traditional mental health support systems are failing executive leaders. I'm going to introduce the ADPE Framework. This framework is transforming how executives handle stress and maintain peak performance. What most people don't understand about executive stress is that it's fundamentally different from regular workplace stress. According to the Harvard Business Review, the traits that make leaders effective, like being hypervigilant and constant multitasking, are the exact same traits that can lead to increased anxiety and sleep disturbances. Think about it. Every decision you make impacts hundreds, sometimes thousands of lives. One wrong move could lead to layoffs, affect stock prices, or damage the company's reputation. This isn't just about managing your email inbox or meeting deadlines. It's about carrying the weight of the entire organization or agency on your shoulders. Here's what makes it even more challenging. Research shows that 76% of senior leaders feel isolated in their role. Traditional mental health programs often group executives with other employees, completely missing the unique psychological burden of leadership. It's like trying to treat a specialized condition with a generic approach. It just doesn't work. Next, the confidentiality paradox. Here's where traditional mental health support really breaks down for executives. Standard employee assistance programs and corporate wellness initiatives, while have great intentions, create what I call the confidentiality paradox. Let me share a real example. A client of mine in a federal agency needed support dealing with burnout, but using the agency's mental health resources, potentially exposing his struggles to subordinates or superiors. The very act of seeking help could undermine his leadership position. This is why generic programs fail. They don't account for the complex political dynamics and reputation management that executives must navigate. Leaders need a completely confidential, separate channel for support that exists outside of their organization structure. Traditional mental health support typically operates on a reactive model. You seek help when you're already struggling. But for executives, this approach is fundamentally flawed. By the time a leader is showing visible signs of stress or burnout, it's already affecting their decision-making and leadership capability. This is where our ADPE framework comes into play, a proactive approach specifically designed for senior decision makers. The A is for assess. We want to identify hidden stress points before they become critical. This includes mapping conflict, decision-making fatigue patterns, isolation factors unique to your position. Then we diagnose by evaluating your current coping mechanisms, both healthy and unhealthy. What are your sleep metrics? How are your key relationships being affected? And what is your current emotional regulation capacity? Then we want to prescribe. This is where we implement tailored solutions that work within the constraints of your executive schedule. For example, one of my clients, a CEO of a technology company, was experiencing severe decision fatigue. We implemented a 10-minute transition ritual between meetings, and this is just a simple practice that reduced his burnout symptoms by 40% over 3 months. Then we want to evaluate by continuously monitoring and measuring specific indicators like energy levels, decision qualities, and relationships over time. This isn't about a woo-woo wellness metrics. It's about quantifying improvement in executive performance and well-being. Let me show you how this works in practice. Another client, a senior federal leader, was struggling with what she called constant pressure to perform. Using our ADPE framework, we discovered that her stress wasn't actually from work itself, it was from the isolation of leadership, especially during the rifts. We prescribed a combination of confidential executive coaching sessions, a private leadership forum with peers at her level, and micro recovery practices integrated into her daily schedule. Through careful evaluation over 90 days, we tracked significant improvements in her sleep quality, which improved by 60%, her strategic decision-making skills and confidence increased, and the team reported a 35% improvement in leadership effectiveness. Regular evaluation allows us to fine-tune interventions for optimal results. Strong leadership isn't about avoiding stress, it's about building the resilience and support systems to navigate it wisely. The ADPE framework provides a structured, confidential approach that works within the unique constraints of executive leadership. Remember, taking care of your mental health isn't a sign of weakness, it's a crucial component of sustainable leadership. The most effective leaders I've worked with aren't the ones who don't experience struggle. They are the ones who build robust systems to manage the inevitable pressures of executive decision making. Now, if you found this valuable, you will love my next video on how to remotivate teams when you feel like giving up yourself. Click the video screen now to watch it, and don't forget to subscribe to our channel.